the next pathology which we'll be looking at is what? Hydrocephalus. So we're looking at the pathology of hydrocephalus. So hydrocephalus is literally water in the brain. Yes. Hydro is water, cephalus is brain. Do you understand? So there's accumulation of water in the brain. Although this is a synthetic baby, but this is how in a normal scenario it's also look like. So what's the pathology? So for the introduction, first of all, you know that was a neuropathological condition where you are having what? Fluid accumulating in the brain, and that fluid is cerebrospinal fluid. It's accumulating within the brain ventricular system. So this leads to ventricular dilation, increase intracranial pressure. So it could be congenital, that means like, you know, they just gave birth to the person with it, or it could be acquired. That means, you know, some issues over time actually blocked, you know, the flow of cerebrospinal fluid, leading to the accumulation. So what's the core pathological mechanism? First of all, it arises from either one of these. It could be overproduction of CSF, or it could be that CSF is produced normal, but the flow of it is obstructed, leading to the accumulation. So either one of these is what is causing, you know, fluid to accumulate in the brain. So examples of the obstructions could be what? Aqueductal stenosis. Of course, the obstruction is much more common. Overproduction is rare. Okay. So aqueductal stenosis, tumors, hemorrhage, you know, congenital malformations. Impaired CSF absorption is seen in communicating hydrocephalus. Okay. Meningitis can also cause it. If there's bleeding in the brain, can also cause it. Do you understand? So histopathological features. All right. It lies like if you observe the brain that is affected by what? Cerebrospinal fluid. All right. What will you notice? Ventricular dilation. So the ventricles are big. Ependymal what? Disruption. Periventricular edema. Axonal damage. Gliosis. Cortical thinning. Okay. So types of hydrocephalus, you can have the communicating one where the CSF is flowing freely. You can have the non-communicating one where obstruction is preventing the CSF from exiting the ventricles. Have the normal pressure hydrocephalus, S vacuole hydrocephalus. We'll talk about all of them, right? Especially the next one I'm talking about is the S vacuole hydrocephalus. This one, there's an expansion of the ventricles, but it's not due to fluid accumulation. It's because brain is kind of like eating away. Okay, we'll talk about that. So clinical features is that the head is big. Okay, bulging fontanelles. Adults, you have headache, you have gait disturbance, you have cognitive decline, urinary incontinence, all right, and all of that. Okay, so this is for the pathology, trying to look at how this disease condition will look like.